Howdy, Dwight here with CPAP for Me again. Just wanted to share with you a new mask that's out on the market this year called the Pilairo by Fisher & Paykel. It's an outstanding nasal mask that I believe in and have put on a number of patients, and they've had great success with it where they've failed with many other masks. And I'd like to share with you a few of the reasons why that is. So first thing I'd like to do is show you the packaging. It comes in a nice clear package. You can clearly see the mask in here with the cushions on the inside. It's a very handsome package. It's easy to look at. You can tell exactly what you're getting. It opens up like so. Very easy to open it up. This pops out. And then we pull the mask out. Just like that. Obviously all the instructions here about how to use the mask, how to clean the mask, all that stuff from Fisher & Paykel. Strongly recommend that after you purchase this mask that you read through those, because there's a lot of valuable information in there for you. On the mask itself, what you'll notice is that it's a nasal cushion, but it actually has two layers of seals. So we have the first layer that inserts directly into the nostril, which provides that nasal pillow effect. And then we have a second seal that inflates from back pressure, from your inhalation and exhalation, and the pressure of the machine, and then forms a second seal across the bottom of the nose. So really good technology there from Fisher & Paykel to have a double seal. Now that does compensate for one of the weaknesses of this mask, and that is patient perception. So most of your nasal pillow masks that you've seen in the past have two pieces of headgear so that we really get a good grip on the crown of the head. And this one doesn't have that. Instead, they've gone for an elastic headgear that stretches out and forms the tightness across the back of your head. So what we have here is a mask that stays in place very well, but doesn't feel quite as secure to the patient. So some of the patients feel that they are not getting quite the seal, and they will do things like tie the straps up on the side to make it tighter. One of the biggest reasons that we indicate against that is because doing that typically causes excess pressure on the nose, and you only have to push on your nose a little bit to figure out that it doesn't feel very good. So we strongly recommend that you just keep it like it is. Yes, it's going to feel a little bit insecure at first, but it's something that you'll get used to over time. The next thing you'll notice is that the tube itself on the mask is much shorter than what's seen typically on a nasal cushion mask. So typically we'll see a tube that's at least a foot long, and this is significantly shorter than that. It does have a quick disconnect here, which is great for patients that like to get up and go to the bathroom in the middle of the night. They don't have to take the entire mask off. All they do is disconnect this, go to the bathroom, leave the mask on their face, come back, pop it right back in. As a CPAP user myself, I can tell you there's a definite difference in taking a mask off and going to the bathroom than not taking your mask off. You wake up far less by just using your quick disconnect. Next thing is cleaning. It's a very, very easy mask to clean. The cushion just simply pulls off. It doesn't take a lot of effort or force. There's no clumsy seal to make with it. It's very simple to get off. So you just pull it off. The way I recommend cleaning it is with soap and water. I personally choose to use hand soap. The manufacturer, I believe, indicates mild detergent of some sort. And what I recommend is just soap and water just like this. Just wash it in your hands. Rinse the suds out, and then shake the water out. Once you've shaken most of the water out, reapply it to your mask. Very easy to do with this particular mask. All we do is take this notch and fit it in that groove. So once we've done that, we stretch it around the bottom, just like so. And now we have a nasal cushion that is in place. The sides, for me, have always taken care of themselves. I have not even had one time where the sides did not just pop right in from sealing it around the bottom like that. So outstanding mask, very easy to use. It has good support for the upper lip right here, so that it doesn't push against your face too much. And like I say, the only complaint that I really get about this mask is sometimes patients will improvise their own ways of tightening it, and that always makes it not as good. So I would strongly recommend against tightening this mask up any further. I'd love to have a conversation with you about this mask. If you want to talk more about how the Pilairo can help you get a better night's sleep and use your CPAP machine more effectively, feel free to send us an order at orders@cpap4.me. Thank you.